Welcome to the Explainer. Today, we're essentially cracking open the medical case file on the hantavirus. We'll be using direct data and fact sheets straight from the World Health Organization to really wrap our heads around this dangerous and, frankly, super stealthy pathogen. The goal here is to make the complex science completely accessible. We're going to map out exactly how it works, where it hides, and most importantly, how you can protect yourself. To set the stakes right out of the gate, we're looking at this right now because back in May 2026, the WHO actually had to respond to a cluster of hantavirus cases linked to a cruise ship. I mean, think about that for a second. Usually when we hear about zoonotic viruses, we picture deep jungles or remote farmland, right? But this recent event proves this virus can absolutely surface in highly unexpected places. It's a huge wake-up call that we need to understand how this pathogen moves and operates in our modern world. All right, let's jump straight into our playbook for today. We're going to profile the suspect, map out its global footprint, break down how infection actually happens, track the patient journey, and finally, lock down our defense protocols.
Starting off with Section 1, the suspect. Let's see what kind of biological threat we're actually dealing with.
So the whole problem starts right here. Hantaviruses belong to the family Hantaviridae. They're zoonotic, which just means they jump from animals to humans. But the wild part, the real key to this puzzle, is that these viruses naturally infect rodents without making them sick at all. The rodents are basically acting as these perfectly healthy, long-term hiding spots. They're a natural reservoir for a pathogen that, the second it jumps to a human host, becomes incredibly dangerous and triggers some really severe, fast-moving disease. And the global scale of this is pretty staggering. According to the WHO, we're looking at an estimated 10,000 to 100,000 hantavirus infections popping up every single year worldwide. Now sure, that might sound a bit low compared to something like the seasonal flu, but the sheer severity of these infections makes it a massive public health concern, especially when you realize how and where it strikes.
Which brings us to Section 2, global footprint. Let's look at how geography totally changes the nature of this disease. The craziest thing about this virus is that it operates completely differently depending on where you're standing on the map. It basically splits into two distinct clinical syndromes. Over in the Americas, they're battling a severe respiratory illness called Hantavirus Cardiopulmonary Syndrome, or HCPS. This one aggressively attacks the lungs and the heart, and guys, it carries a really staggering fatality rate of up to 50%. Meanwhile, Europe and Asia see thousands more cases annually of a totally different syndrome. Hemorrhagic fever with renal syndrome, or HFRS. This variation goes after the kidneys and blood vessels instead, and thankfully it has a much lower fatality rate, generally sitting somewhere between less than 1% and up to 15%.
But there is one fascinating and honestly pretty alarming anomaly down in South America, specifically in places like Argentina and Chile. It's called the Andes virus. This specific strain is the only currently known hantavirus that is actually capable of spreading directly from human to human, no rodents required. Now, it's still rare, but this human-to-human transmission happens through close, prolonged contact, usually among household members or intimate partners during those early days of the illness. Moving to Section 3, how infection happens. If human-to-human spread is the rare exception, how are those thousands of people actually catching it? Well, outside of that one specific Andes strain, infection almost entirely happens when humans cross paths with a contaminated rodent environment. We're talking about exposure to rodent urine, droppings, or saliva. In super rare cases, you might catch it directly from a rodent bite, but the main driver is purely environmental. The virus is literally just hanging out in the excretions left behind by these completely healthy-looking animals. And that means you can unknowingly put yourself in the danger zone doing totally everyday things. The absolute highest risk comes from enclosed or poorly ventilated spaces. Think about cleaning out an old shed, farming, forestry work, or honestly just sleeping in a rustic cabin that happens to have a hidden rodent problem. In places like that, those invisible viral particles are literally just waiting to be stirred up. That leads us right into Section 4, the patient journey. Let's track the timeline to understand why this thing is basically a ghost to doctors. So the disease has this frustratingly slow, sneaky onset. Let's say you do clean out that dusty cabin. It can take anywhere from 1 to 8 full weeks, depending on the exact virus type, just for the incubation period to wrap up. And when those early symptoms do finally show up, they're super generic. We're talking fevers, headaches, muscle aches, and maybe some stomach issues like nausea or abdominal pain.
which, as you can imagine, creates a total diagnostic nightmare for doctors. Because that early phase perfectly mimics the flu, COVID-19, dengue, or just a standard viral pneumonia, it is incredibly tough to catch early on. Doctors have to rely heavily on asking about a patient's recent travel or specific rodent exposure to even think about hantavirus. And once it's on their radar, they have to use complex molecular testing like RT-PCR or serological tests to actually confirm it. Time is absolutely critical here because the disease can rapidly snowball into severe lung fluid buildup or complete kidney failure.
Since early diagnosis is so tough, and since we don't have a licensed vaccine or a specific antiviral cure right now, just supportive medical care, we have to focus entirely on Section 5, defense protocols. The absolute golden rule of defense, and this comes straight from the World Health Organization, is this: preventing hantavirus infection depends primarily on reducing contacts between people and rodents. Sounds like a no-brainer, right? But it actually takes proactive, structural steps to keep rodents totally locked out of where we live and work.
You can start fortifying your space right now. Here are the absolute non-negotiables. Keep your homes and workplaces immaculately clean. Physically seal up any tiny gaps or openings that could let a mouse squeeze in. Make 100% sure all your food is locked down in secure, impenetrable containers, and wash your hands like crazy, especially after working outside or in storage areas.
And that brings us to a wildly surprising but incredibly vital rule for your safety. If you do happen to find rodent droppings, you must never dry sweep or vacuum them. Seriously, never. Doing that violently kicks up the dust and aerosolizes the virus, essentially launching those infectious particles straight into the air you're breathing. It instantly turns a localized mess into an airborne threat right in your face. Instead, if you absolutely have to clean a contaminated area, the WHO has a very specific, safe procedure. You always have to thoroughly soak the droppings and the surrounding area with liquid first. Using a wet method traps the virus right where it is, stopping it from going airborne before you safely wipe it away. It's such a minor tweak to how you clean, but it could literally save your life.
So, wrapping our heads around all this, knowing that a potentially fatal, highly resilient pathogen can just linger quietly in the dust of our everyday spaces, how's that going to change your approach? The next time you pop open the door to an old, sealed-up storage shed or a rusted cabin, what precautions are you going to take to protect yourself from the invisible threats waiting inside?